Welcome. I would like to invite you to this body scan practice. The body scan, like any other practice that we explore in this program, is a way to strengthen our mindfulness practice. Mindfulness means to pay attention to the present moment with a sense of curiosity and interest. And by doing this practice regularly, you are taking a powerful stand in your life to cultivate the ability to be with yourself and life as you meet it, from moment to moment. As you are beginning this new process of strengthening your capacity to be with things exactly the way they are right now, it's very important to be gentle with yourself. We may wish our bodies were different. We may have all sorts of ideas about what our bodies are or aren't and what they should be like. But for this time, seeing if it's possible to notice any of those kind of thoughts as they arise, not to get tangled up in them, but instead to see if it's possible for you to bring a sense of kindness, warm-heartedness, and gentleness towards the body instead. The body scan can also put you in a deep relaxation, but we are not trying to relax. Trying to relax can be counterproductive. We are not trying to make anything happen, but we are exploring what's actually here. If there is relaxation, that's what we are noticing. If there is restlessness or tightness in the body, that's what we are noticing. This is a time that you are giving to yourself. It's best to do this in a warm and protected environment where you feel comfortable and secure, and at the time you know you will not be interrupted by anyone or by any devices. Making sure you are wearing loose, comfortable clothes, especially around your waist. Now coming to a lying down position on a yoga mat or a thick blanket or a foam mattress, if that's okay for you. If not, you can be sitting on a straight back chair with the feet flat on the floor, your hands resting comfortably on the lap, and allowing the back to be straight and upright, but not rigid. You can also do this practice by sitting on the cushion if that's more comfortable for you. If you are lying down on the floor, a little pillow under your head if that's supportive to you, or under your knees. Whatever helps you to be more comfortable and be at ease. And allowing your feet to fall away from each other. And if it's okay, allowing your palms to open towards the ceiling along the side of the torso. You can also have a small blanket on your side, so that way if the temperature shifts, you can always use that blanket if you want. We are trying to be comfortable, but not too comfortable, because being too comfortable can prepare the stage to fall asleep. And body scan is about staying awake. And if you find yourself falling asleep, you can, as soon as you are aware, you can bring yourself back to the guidance wherever we are and follow along. And if the drowsiness continues, you can even have your eyes open or come to a seated position in a cushion or on a straight back chair. Now allowing your eyes to close gently if that's okay for you. If not, keeping it partially open with a soft gaze on the ceiling or on the floor a couple of feet ahead of you, but away from the screen. Now bringing awareness to the entire body as it is laying down in this way, or sitting on a chair or a cushion, in whatever way the body is right now, bringing awareness to the entire body right now. Noticing the touch point, how the body is meeting the floor or the chair or the cushion. Noticing the weight, gravity. Perhaps you're also noticing how the breath is animating this body right now. Maybe you are aware of the rising and falling of the belly. Or the chest. Or perhaps you're aware of how the breath is entering through the nostrils and coming out. Or maybe you are noticing the entire cycle of the breath. This laying down position is even called a corpse pose, but this is about being alive. Noticing how alive this body is through the coming and the going of this breath. Seeing what you can notice. As you journey through the body, knowing that this body carries its own history. Anything that happened to us happened to this body. So this process may evoke different thoughts, emotions, stories, or memories. Just noticing them and bringing your attention back to the body where the guidance is at this moment. If the emotions or thoughts are too uncomfortable or distracting, You can also bring your attention to this entire body or the movement of the breath in and out of the body, which can serve as an anchor to the present moment. And once you are more stable, you can come back to the guidance. Also knowing that there is no one right way of doing the body scan, which means you cannot do this wrong. You have a body which is alive, and allowing the wisdom of your body to inform you of how to meet yourself. Now bringing your awareness to your left foot, the toes on your left foot. Noticing what you can notice. Your big toe, your small toe, and all the toes in between. The spaces between the toes. Maybe the temperature around it. If you have a socks on, the sensation of the touch of the socks. Or the air, or whatever you can notice. And if there is no sensation, then that's what you are noticing. There is no need to create a sensation by bringing movement or anything. We are not creating anything out here. We're just noticing. And if there is no sensation, that's what we are noticing. And bringing your awareness to the base of your toes. And the bottom of your foot. The ball of the foot. The soft part in the middle. And the heel of this left foot. Perhaps you are noticing the touch of the heel on the floor if you are laying down, or maybe the touch of the entire foot in the ground if you are sitting on a chair. So noticing the touch point, the pressure, the weight, the temperature. Noticing the top of your foot. The skin around the foot. Or the bone that's inside it. Or the muscle. Whatever you can notice or not. Now bringing awareness to your left ankle, circling your awareness around this ankle, and seeing what you can notice around here. The part of the body which we hardly notice unless there is some pain or discomfort in it. And yet it provides so much support and flexibility throughout the day. Bringing a fresh look towards this part of the body and seeing what you can notice here. Now noticing the entire left foot and ankle area, and moving the awareness to the lower left leg. The shin of the leg, the calf, any touch point, any sensation of weight, pressure, whatever you're noticing right now at this moment in your lower left leg. The skin, maybe the muscle. Now coming to the left knee. This is the part of the body where most of us has some pain as we age. And we might have ideas about this part of the body, thinking that I know everything about my knee pain. But now, for this practice, seeing if you can look at it freshly with a beginner's mind, with a sense of curiosity and interest. Seeing what we can notice around here. Any pressure, any pain, or not. The front and back of the knee, the side of the knee. Now bringing awareness to the thigh, left thigh. This large muscle in our body. Seeing what you can notice around here. Giving it all the attention that it needs. Maybe the touch of the thigh on the floor or the chair on the surface, or the touch of the cloth around it. The muscle and the bone, whatever you notice in your left thigh. Now bringing the awareness, expanding your awareness to the entire left leg. From the toes, entire left foot and ankle, the lower leg, the shin and the calf, knee, and the entire left thigh. And the hip joint where the thigh meets the hip. Now moving through the hip and pelvis area and coming down to the right leg, all the way to the toes in the right foot. Now bringing awareness to all the toes in the right foot. And seeing what you can notice out here. Any tingling, any vibration, any pressure. The big toe, the small toe, and all the other toes. What can you notice in between the toes? Any moisture or dryness? Now coming to the base of the toes and the bottom of the right foot. The ball, the middle part, the soft middle part of the foot, heel of the right foot, anything that you can notice, bringing a sense of curiosity and interest. We are like a scientist investigating our own body. So now coming to the top of the right foot, and to the ankle of the right foot, circling your awareness around this ankle. And bringing awareness to the entire right foot and right ankle. Now coming to our lower right leg. Noticing what you can notice in the shin, the bone, anything that you can notice around here. Calf, the big muscle, seeing what you can notice out here. And anytime you find your mind wandering, that's normal. No need to beat yourself for that. Simply bringing the mind back to this moment where the guidance is happening and following the guidance along. Now coming to the right knee, the front of the knee, the back of the knee, the sides of the knee, now coming to the right thighs, this large muscle, giving it all the tension that it needs. See what you can notice. Any pressure or tightness. Noticing the hip joint where the thigh meets the hip. And now noticing the entire right leg from the toes to the top of the thighs. And coming to the area of the hip and pelvis. And bringing awareness to all the sensation around it and inside it. Perhaps you are being aware of how the breath is animating this part too, with the breath coming in and going out. Just bringing awareness to this entire bony structure and all the organs that it is holding. The genital and the anus area. Noticing this entire pelvic buttocks area with a sense of curiosity and interest. With the intention to investigate and notice what you can notice. You may even notice some thoughts and judgments. Just being aware of it and coming back to the sensation in the body. Now coming to the bottom of the spine, the tailbone, bringing awareness to the entire lower back, any pressure, any sensation of weight. And maybe perhaps being aware of any judgment. Now coming to the belly area. Perhaps you're aware of how the belly is rising and falling with the breath. Any sensation that you can notice inside the belly. Or or outside in the skin level. Bringing awareness to this rib cage area, any movement around here, any pressure, any sensation. Bringing awareness to the middle back, now bringing awareness to the chest and heart area, and noticing what you can notice out here. The movement of the chest up and down, like the heart is cradling in this movement, or not, whatever you can notice and feel around here. Noticing this front of the chest and the front of the shoulder and the collarbone area. And the upper back, and seeing if it is meeting the surface and any sensation created there. The shoulder and the upper back, notice if there is any tightness. We tend to store all the stresses in this area. So if there is any tightness in there, just noticing what it is and how it is out there. No need to change or do anything about it. Just simply noticing it. And see if it shifts in any way by just bringing some gentle, kind awareness in this area, if anything shifts or not. Coming to the top of the shoulder. Now noticing the armpit, the torso, and noticing both your hands at the same time, the upper arm, bringing awareness to the elbows, the inside of the elbow, bringing awareness to the lower arm, see if you can notice any difference in the sensation on the left versus the right or not. The wrist, an entire hand and fingers, the finger joints, the tip of the fingers, any tingling, any sensation around there. Now bringing awareness to the entire hand, upper arm, lower arm, both right and left side. Now coming up to the shoulder and the throat and neck area, and seeing if there is any tightness around this area, either in the back of the neck or the side of the neck or not. Noticing any sensation on the throat, the outside and inside. Bringing awareness to the jaw area. See what you can notice around this area, any tightness, any holding. Just bringing gentle and kind awareness towards this tightness. And seeing if anything shifts on its own or not. Now coming to the jaw, lips, upper lips, the cheekbone, and the sinus area. The entire nostril, inside and outside. Now bringing awareness to the eyes as it is resting in the eye socket, the eyebrows, the forehead, bringing awareness to both the ears and the ear canal, how the sound enters this ear and is being heard to us. Just being aware of this entire face, ear, and the back of the head, and seeing if you can notice the sensation of having a hair follicles or not. The top of the head, the skin on the bone inside this skull. Now bringing awareness to this entire body. We were focusing on one part at a time. Now we are expanding our awareness to include the entire body, from the bottom of the foot to the top of the head, and seeing how easily it is possible for our awareness to shift. So being aware of the entire body as it is laying down or sitting, noticing how it's meeting the surface it is on. Foot, ankle, the lower leg, knees, thighs, pelvis, buttocks, lower back, belly, the middle back, the entire back, and the spinal cord that's running in the middle, the front side, where the belly and the chest and the rib cage area is, shoulder, hands, neck and throat, and the entire head. Now once again bringing awareness to the movement and the aliveness of this body. There's nothing to do. Simply noticing the movement and the body the way it is right now. You may also be aware of the sounds that's coming from outside the room that you're in. And this whole time you're also hearing my voice. So simply being aware of this body as it's laying or sitting, and the sound that's surrounding. Not trying to go and grab any sound, but just noticing whatever is there, the coming and the going of the sound, the coming and the going of the breath. And the sensation. The parts of the body that feels comfortable, or the parts of the body that does not feel comfortable. Just noticing it all. You may slowly allow your eyes to be open if they are closed.